Okay, this video is what would I do if I had prostate cancer? And so, first of all, standard of care is always recommended by doctors because they have to recommend the standard of care. They're paid to recommend that. That generates a billing code that also protects them from med malprel because they're following the standard. Okay, so, but what I'm going to say is for my own personal sake, I would never check my PSA. I don't want to know what it is. So instead of focusing on an individual disease, what I focus on just maintaining general health. If you maintain good general health, you're very, very, very unlikely to ever die from prostate cancer. So that's what I do. And I've read about a lot of long-term survivors of prostate cancer who they focus on just trying to lower their PSA. PSA is prostate-specific antigen. It's a blood test that's an indicator that when it goes up, there's potentially a prostate cancer growing. It could be elevated for other reasons. You had a digital rectal exam from your prostate, etc., BPH a little bit and whatnot. But what I'm basically saying is, if you eat a low-fat, low-protein diet, that tends to lower mTOR, mammalian target of rapamycin, also called mechanistic target of rapamycin, the nutrient-sensing pathway for growth. Like a building contractor, it waits till there's all the building materials available before it tells cells to replicate. So if you deprive that of leucine, the main rate-limiting step, which is an amino acid more common in meat, you're less likely to have mTOR tell the cells to replicate. So it slows down cancer growth is what that's thought to do. You eat an alkaline diet. Alkalinity helps you improve the function of the immune system. Acidity tends to suppress the immune function. So what's more alkaline? Eating a plant-based diet, especially fruits and vegetables, okay? Because the cancer is always in competition with the surrounding cells. So you want to favor the surrounding cells, the surrounding normal cells. They're favored by good oxygenation of the tissues, and they're also favored by alkalinity. You want to avoid dietary salt, sodium chloride, because the chloride, when ingested in large amounts, displaces bicarbonate ion in the blood. That's a buffer to, help optimize pH. So you don't want to be inducing a low-grade metabolic acidosis by excessive salt ingestion, sodium chloride ingestion. So I wouldn't do that. I don't add salt to my food anyways. You don't want to be eating a lot of sodium anyways, because sodium, it can cause activation of your platelets. When your platelets are activated, that means they're made more sticky, more prone to clotting. They have a tendency to cover metastasizing cells in the blood. And when they provide a surrounding coating around a metastatic cancer cell, they hide that cell from the immune system. Because the immune system works by Braille. Everything in the immune system is always feeling the cells. Do they have the normal, expected, proper self-identifying molecules on their surface? Okay? So avoiding salt is a good reason to do that. You want to exercise because exercise lowers mTOR. You have a seesaw between mTOR pathway and AMPK pathway. AMP is like adenosine monophosphate. Instead of ATP is full energy, adenosine triphosphate, 3 phosphates on your adenosines versus monophosphates, 1 phosphate on there. So what the point is, after you exercise, you're a little tired and your cells send out a signal saying, look, they tell mTOR, shut off. We cannot replicate right now. We are tired. We need to restore our ATP levels. We need to rebuild our energy. So we need to go into a restoration phase, not a growth and building phase. So that slows down the replication of cancer cells. That's what you want to do. I would avoid these estrogenic chemicals. The breast and the prostate and the uterus are all estrogen sensitive, meaning estrogen will cause proliferation of cells. So the male prostate's a little bit like an embryological equivalent of the female uterus. So you want to avoid all these estrogenic chemicals. They're everywhere. And the only way to, I think, effectively avoid them is to be very simple. Very simple. I don't use any personal care products. I got one little transparent bar of soap in my bathroom. That's it. Okay, I don't use shampoo. I don't use conditioner. No cologne. All that stuff I think is for sissies, and I think it's kind of stupid. Some guy walks in the room and he smells heavy of cologne. You always think, nice guy, loser, idiot. Okay. What else? I don't even use any laundry detergents. I just put it in the laundry and have it run high hot cycle and go for my regular clothes. For my dress shirts, not as much. But basically, you don't need any laundry detergent. Laundry detergent's got 3 estrogens, okay? First of all, the detergent itself, something like nonanol 9 or something. And then it's going to be in a BPA plastic bottle. That's estrogenic. That's a mitochondrial inhibitor. There's going to be phthalates to condition the plastic. So that's 3 estrogenics right there. And then that goes on your clothes. And then your skin is mostly lipid to keep water out. Like you swim in the water, you don't get waterlogged because like dissolves like in chemistry. The point is your skin being lipid, estrogen's a lipid, it gets transdermally absorbed. So then it's being absorbed through your skin all day long if you use laundry detergent. Those dryer squares are also estrogenic. So the point is that you also don't have a first pass effect. If I drink an estrogenic chemical, my liver will remove about half of it or so. It's called the first pass effect because it goes from your gut through the portal vein to the liver and it can be detoxified a little bit. Okay, so what I'm saying is on your clothes, you're all day long being exposed to estrogen if you're using all that laundry detergent stuff. It's very easy to avoid. For dishwashers, I don't even put my dishes in a dishwasher. I just rinse them off, okay? If you're going to use the same dish again, you don't need to put it in the dishwasher. That tends to be estrogenic too. And I realize these are all minor details, but I call it the philosophy of incrementalism that I learned from Dave Schultz, world and Olympic champion wrestler. Is basically you do 20, 30 little things right, and you don't even know which one you're getting the benefit from. Each one might only be 1%, 1/10 of 1%, but they all add up, and then together in aggregate, they make a big difference, I was hanging around with a bunch of doctors last week that are around my age, a little younger, a little older, some of them. And I just felt like I had so much more energy than they did. It made me feel good. And I'm like, wow, I'm doing something right because I got the energy. I still got it. Let's see, what else? I run upstairs a lot every day, and I do it on purpose. I make myself go until I'm all breathing and sweating. And like when I first walk out of the stairs, I look like a crazy person, huffing and puffing. But the reason I do it is because that's all it takes. It's high intensity interval training. So if you work somewhere where you have to go up, where you have a choice to take in the elevator, take the stairs, I would say always take the stairs. And I think that's a good sign of human character. The average lazy person takes the half-ass route and takes the elevator. A person with determination takes the stairs, okay? And what would I say? What percentage of people that I've seen do it? About 1 in 1,000, okay? It's just sitting right there. Why wouldn't you take that opportunity to get some quick exercise, a free health club effect? Let's see, what else would I do? Stress management. When you're psychologically stressed, basically, it's being chased by a saber-toothed tiger in the dark, okay? That makes your blood prothrombotic, which is bad. That can contribute to tissue hypoxia, a little bit less oxygen delivery when the red blood cells are sticking together, because it elevates the acute phase reactant proteins like fibrinogen. You don't want to be drinking caffeine. Caffeine elevates the same hormones as stress, increased cortisol, increased catecholamines, adrenaline, and noradrenaline. You want to make sure you're getting your sleep. Sleep deprivation raises those same hormones. All of those things turn off your immune system. The reason is our body has limited resources. So when you're being chased by a tiger, you just want to survive the next 30 minutes. Our stress system is designed for acute physical stresses. All right, so the point is when you're psychologically stressed, that often lasts for days or weeks even. And then you have your immune system shut down. It's your immune system that removes the metastatic cancer cells. Because basically, let's say you have prostate cancer. Nobody dies from a big prostate. The worst thing that could happen from a big prostate is it gets so big, it blocks your prostatic urethra and that you can't urinate. Okay, well then guess what? We can put in a Foley catheter. We can even put in a suprapubic cystostomy coming in from above the pubic symphysis. Okay, we can drain your bladder. That is not a big deal. Nobody's going to die from that. So what I'm trying to say is, I wouldn't sweat the prostate. What matters is metastatic disease can kill you. Brain mets will kill you. Lung mets will eventually potentially kill you. Diffuse liver mets will kill you. All right? So what you want is to have a good immune system. And so the way you have a good immune system is get your sleep, avoid caffeine, manage your stress, have a sense of purpose in life that gives you more resilience, have religion, faith in God, do things you enjoy. Like I love listening to Christian music. Okay, it puts me in a good mood. It has a soothing effect on me, so that's pleasant. Okay, I enjoy listening to an audiobook in my car, and I often listen to literature because with literature, I get lots of ideas from literature. I hear the story and I'm like, hey, that's a metaphor to this. Hey, that's a metaphor to that. And I find that helpful. I also think it improves vocabulary. It gets your brain thinking. There's a complexity to literature following the story it's like entertainment for your brain. It's very enjoyable. Okay, what else? I've seen a lot of patients have problems from prostate, okay? From the prostatectomy surgery. Look at Gilbert Welch's book, Overdiagnosis. His friend, another doctor epidemiologist, he said he basically was severely weakened for 6 months after prostatectomy. So a lot of patients become impotent. Some develop urinary incontinence. Some have some chronic pain in that area. It's really rare, but I have seen, this is super rare, but I have seen it. Colon injuries with pelvis abscesses. I've had to drain a bunch of pelvic abscesses. It was this one guy, he meant well, typical chump of a patient. They go, oh, I'm going to go for the robotic procedure. And I'm thinking to myself, a typical patient, they're always impressed by bells and whistles, robotic surgery. I would think to myself, how graceful and coordinated are the robots you've seen? I wouldn't trust a robot to operate on me. So anyways, he goes to this big university. I'm not going to say the name. It's an Ivy League equivalent type university. And they lacerated his rectum. He had like 7 abscesses in his belly. That was back when I was working mostly as an imaging-guided surgeon. I had to drain 6 of them. One of them I couldn't get to it. And he was on antibiotics for like 6 months. And he ended up doing okay. But I'm just saying, why take that risk? Is that going to increase your survival? It's not the prostate that's going to kill you. It's the metastases potentially. So anyways, a lot of times prostate cancers are turtles, meaning that they grow really slow. If you had a animal enclosure about 100 square miles, and in the center of it, a fenced-in area where you kept 3 types of animals. You had vultures, and you had rabbits, and you had turtles, okay? Now, let's say a vulture breaks out of the central enclosure, and it makes a flight for the fence. The vulture is going to get over that fence, get out of the fence. Once it gets out of the fence, the patient dies, okay? And it's going to kill you. There's nothing you can do. But that almost never happens. They grow so rapidly, you can't screen for a vulture. They're just super, super, super rare, all right? Then the next thing is a rabbit. A rabbit, digs a tunnel underneath your central fenced-in enclosure area, and it makes a run for the fence. So it's stop the rabbit, okay? That's what everybody thinks cancer is. But the reality is most cancers are turtles. And the turtle, even if somebody forgets and leaves the gate open, the turtle starts walking for that fence 100 miles away. You're going to die of something else by the time the turtle gets to that fence. So I wouldn't sweat it. That's why it's better to not know. For a lot of cancers, you're better off not knowing if you had a really, really low-grade prostate cancer, if you had a low-grade thyroid cancer, if you had a low-grade breast cancer. A lot of times you'd be better off not knowing because the treatment is more likely to injure you than benefit you. Okay, so anyways, if I could track my PSA, which is a wonderful thing to have with prostate cancer, most of them at least, and I could just keep it down. Look at the Ornish study, biopsy-proven prostate cancers, and the patients who ate a vegetarian diet, managed their stress, all of them kept their PSA same or lower and didn't have to go on for further interventions like surgery or radiation, for example. Okay, and if my PSA was bumping up, I'd adjust my behavior a little bit, see if I can get it back down. And if I couldn't, maybe then I would consider some type of chemical treatment first. Because the chemical treatment goes systemic through the body. I don't know. I would have to study it more. I'm certainly not up to date on all the latest subtleties of the chemical treatments. But you see what I'm saying is I don't want any morbidity if I can avoid it. Morbidity means side effects if I can avoid it. There's no side effects from getting your sleep and eating the healthy diet. So I would push that as far as I could push it. I would exercise a lot because when you exercise a lot, not only do you activate the AMPK pathway, but that's how your immune cells travel around your body, the white blood cells. Basically, your arteries and veins are connected to your heart. It pumps them. But you have a parallel circulation, parallel to your arteries and veins, and lymphatics. And that's where your white blood cells travel. There's no heart connected to it. So you have to move your muscles to get the white blood cells to travel around so they can have all these contacts, and where they interact like Braille to feel and check for metastatic cancer cells and thus keep them under control. So that's what I would do. I've never had surgery in my life. I don't want to ever have surgery in my life. It's not fun. Sometimes people need it, and it can really help them, okay? But it's not something I go volunteering for. I don't take any pills, and I don't want to ever have to take any pills for my whole life. See, a lot of people, they think it's normal that, by the time you get over 50 or 60 or whatever, that, you probably got to be taking a couple pills. You better go get your checkup every year. Bullshit. What you should do is eat and live and sleep in a way that makes you healthy and try to avoid the healthcare system as much as you can. So, anyways, and there's a whole bunch of case reports and book chapters on what I've just told you. That's what I would do. And you definitely want to filter your water because, again, that's how all it takes is at least a carbon filter. You can get the estrogenics out of your water to avoid the hormonal effects. So anyways, that's what I would do for what that's worth.